About 2/3 of individuals living with dementia and in residential aged care experience 3 or more episodes of urinary incontinence each day. Urinary incontinence is the accidental leakage of urine from the bladder, and it's very common. It can happen to anyone, but it's more common in older adults and particularly in women. My project is about working with consumers, so people living with dementia and their carers, as well as healthcare professionals, to develop resources to support decision making for medications for urinary incontinence. So when to start, when to continue and when to stop. The most common medication used to treat urinary or manage the symptoms of urinary incontinence are a medication class called anticholinergics, but they can cause a number of side effects, particularly in older adults and particularly in people living with dementia. Things like dry mouth and constipation, but they can actually cause quite a significant impact on quality of life for older adults. We're not necessarily saying that the medications should or shouldn't be used, but wanting to ensure that people are educated and aware of both the benefits and the risks. This is a true co-design project, so we're involving people living with dementia, their carers and healthcare professionals throughout the entire project. So we're running interviews and focus groups and workshops to help design these resources, and people living with dementia, carers and healthcare professionals are involved in every stage. All the different documentations and the interview guides and everything that will be going out to the participants in this study. And my hope would be that in all healthcare settings, particularly in residential aged care, that these resources would be available when these conversations need to happen.